Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the US and around the world and give you expert insights on infectious diseases and public health. This is the weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, the outbreaks that you need to know about. I do this with my friend and colleague, Jon Epstein, a veterinarian virologist and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, Jon, for joining me today.
Yeah, my pleasure, Jay. How are you?
I'm doing well. It's good to be back kind of on a more regular schedule. I know we had a little time off over the holidays, and I'm sure your kids are now back in school, I guess.
It is the season. I mean, we're just hitting fall, right? And school is underway. I guess we're about a month in at this point. It's going well, though. I mean, it's nice to have that routine back in play.
I know. Well, it's good to have some routines because the world of public health just seems to be collapsing.
Anything but, yeah.
Exactly. And I don't think we'll talk too much today. I think we can save it for another time to reflect back on, the chaos of the past week. Just to highlight a few things, there was the CDC website. If you go to the About section of CDC, it's been changed to be this very unusual political document talking about how, CDC is going to no longer recognize gender. It's going to no longer talk about equity among minority populations. It's going to keep the streets safe. I mean, it's a very unusual document. I advise people to read it and to have a barf bag by them while they do. And we also have
government websites are starting to conform to an overarching narrative. I mean,
they are, and then we saw it in
Yeah.
real time during the advisory committee, the ACIP advisory committee on immunization practices meeting, where
the other big news from this past week.
Yeah, and I don't know what your thoughts on it were, but it was just another perfect example of how sort of people appointed to these political positions who you spent their most of the past 5 years just shit posting on social media, when they're asked to perform in a really thorough, diligent policy role, you can see them just collapsing in real time. They just don't understand like the processes. They don't understand the questions. They don't understand how voting works. Yeah.
Yeah. I mean, these people were thrown into a room in the last minute. Half of them were appointed in the last few weeks. And so it's no wonder they weren't familiar with procedure. They didn't really understand how the discussions work or what they're based on. And it showed in their decision making.
Yeah. And what's fascinating about it and horrifying at the same time is, they wanted to argue that the ACIP was just this rubber stamp for pharmaceutical companies. And what they were forced to learn in real time, I don't know if they'll acknowledge this, is that the process is incredibly rigorous for reviewing this data and making these decisions. And they can't just be made randomly. And you saw that in real time with the hepatitis B voting when they actually had experts presenting to them all of the reasons why the birth dose vaccination. It was almost as if people were discovering it for the first time, that in fact, oh, wow, there actually really is a rational public health reason why these policies were put in place. And it's not some weird conspiracy of pharma companies and public health elites.
And even when asked the simple question by external experts, why are we debating the hepatitis B vaccine? What is the actual concern? They couldn't come up with a clear rationale for what was triggering a decision at this point on whether that should be changed.
No, it was really fundamentally like babies shouldn't get jabbed. And that's a way to, saying that like babies when they're born are getting an injection is a way to marshal sort of emotional reactions from people who are vaccine hesitant or vaccine questioning in some way.
Yeah.
And saying, see, look, not only are they giving you this measles vaccine that might harm you in their view, but they're also jabbing your baby from the moment they're born. So,
right, which could be saving its life.
In fact, yes. And let's talk a little bit about that. Let's transition now to our first story because it is directly linked to this, because one of the very non-evidence-based statements that's on the new CDC website in their About CDC section is basically arguing that harm reduction does not save lives and in fact promotes drug use, number one. And number two, public health agencies should not talk about housing, and that housing has nothing to do with health. And the reason I bring that up, of course, is because the first outbreak I wanted to talk today is a direct explanation for why we need harm reduction and housing as part of healthcare. All right. So, Jon, Maine.
Yeah,
Yeah. The
Maine, love it. Spent a lot of time vacationing up there as a kid. Beautiful
Yes,
country.
you're a New Englander.
I'm a New Englander.
Did you ever think about HIV in Maine, the HIV
Mhm.
disease? We always think of it as a disease primarily in the United States in big cities, right? We don't
Right.
necessarily think about it in more rural places like Maine.
That's true. Didn't cross my mind when going up there to walk along the beach or get into Acadia National Park, but it's clearly an issue right now.
Yes. So the city of Bangor and the surrounding county is grappling with its largest HIV outbreak in the state's history. The county has identified 28 new HIV cases over nearly 2 years. And that's 7 times the typical number for
Hmm.
that length of time. And nearly all of the cases are occurring in people who use drugs and are homeless. And so, John, that's why, we need to be worried and do things that are helpful to people, for people who use drugs and people who are homeless, because it can be a major risk factor for outbreaks like this.
Yeah, and I just, it's worth mentioning because when you say the numbers, 28 cases, people might think, well, that's not so much. Why is that a big deal? And it's really important to remember that everything is relative in epidemiology. If last year there were only 2 cases or, 4 cases, now there's 28, that's something that gets noticed and that's a big difference. And that's the case here. So even though it's not a huge number like we might talk about with other kinds of infectious diseases, this is an increase in what's normal and what's usual. And it bears looking into and figuring out why it's happening so that the numbers don't get even bigger.
Yeah, and in fact, one of the biggest challenges with HIV is, of course, like, if, as with these other infectious diseases, if you don't diagnose and treat people immediately, there's a very high risk they can transmit it to other people. HIV in
Mhm.
particular, we have learned people are at their peak infectiousness during the early stages of infection. That's very important, number one. And then number two is, we know that prompt treatment, effective treatment with antiretroviral therapy, makes people with HIV non-infectious to other people. And in an outbreak like this, where transmission is occurring almost certainly because of sharing dirty needles,
Hmm.
it's really, really important to get people so that there is no HIV circulating in their blood, and to get people access to clean needles.
Clean needles. That's right. Yeah, and it's something that, happens in other cities that, I don't know if Bangor already has a clean needle exchange or a program, but this is definitely something that clearly I think would address the problem.
Well, it's also amplified by the fact that, when people are unhoused, when they are homeless, it means even if they had, access to clean needles, they can't disinfect the other equipment that they use to
Mhm.
inject drugs. They then get desperate. And of course, they're not out there seeking care and treatment. I have patients in my clinic, for example, all the time, who come in and say they're on HIV medications and their medications got stolen, and it wasn't because somebody was looking just for those medications,
Mhm.
but somebody sold their bag, or they were at a shelter
Right.
and somebody was looking for other types of pills and grabbed what they had. And in some situations, HIV pills can be sold on the street as well too. So homelessness is just an incredible risk factor for, people being at risk. We'll talk about this in our second story as well, for diseases like HIV. And the only way to get it under control is to test as many people as possible, get people who are HIV negative on HIV pre-exposure prophylaxis, treat everybody who has HIV with actual HIV treatment, and get people housing and then access to harm reduction like clean needles, if they are in fact going to continue to use drugs.
Yeah, and it's interesting to hear this type of thing popping up in Maine, and it makes you wonder what other comparable states, rural states, are also experiencing increases in cases. Maybe it hasn't hit the news yet, or public health news, but I'd like to know if this is a trend that's happening in other parts of the U.S. too.
Yeah, well, it is a trend so it's not so much a trend, but it is a phenomenon that you can see in many other places and has been seen in many other places. I think one of the examples that a lot of us in public health talk about is that, during, the former vice president, Mike Pence, used to be the governor of Indiana, and
Mm.
Indiana withdrew injection drug services, needle exchange, and everything in Indiana. This is at the peak of the opiate epidemic. And so in 2014 through 2015, there was a massive outbreak of HIV in Indiana with over 200 people being diagnosed, one of the largest outbreaks that we have documented in recent US history. And it really highlighted the risks of injection drug use, and more particularly that when you don't have safe syringe exchange programs, you're going to put yourself at very high risk for these outbreaks. It's not about a morality. We obviously don't want people to use dangerous, illegal
Right.
drugs like this,
Right. Right.
particularly drugs like opiates would put people at risk for dying from overdoses. But we also need to be realistic and provide
Yes.
services to help protect them.
Yeah, I mean, it's two clear prongs of public health approaches. You obviously want to eliminate risky behaviors, but sometimes you just have to acknowledge that that's impractical or very difficult to do. So harm reduction is a really important second prong to this, which is really helping people do what they're going to do anyway safer.
Yeah, and I just want to also just make a crystal clear point about this. These are evidence-based interventions. They have literally been studied in controlled trials, as
Mhm.
well as lots of modeling studies that are done incredibly rigorously, showing that they do not lead to increased drug use, and they avert infections, HIV and hepatitis. They avert deaths. From because you can get people and you're seeing them regularly, can avert them from deaths from these infectious diseases and from other bad outcomes as well. So it's really, really important to recognize this is not public health people taking a moral stance that, oh, we don't care about injection drugs
Right,
and that's why I want to give people needles.
right.
We're
There's
saying
science
this because
behind
it's
this.
actually been studied and it's
Yeah,
actually clear evidence.
yeah, that's a great point.
So, John, I want to switch locations. So we're going to go
Okay.
from Maine
All right. Nice.
all the way to Texas, but this is
Down south.
another outbreak
Mhm.
that has a connection, of course, to homelessness and to concerns about hygiene. So let's talk about typhus in Texas. So we're going to go with alliteration today, okay? Typhus in Texas. This was once thought to be nearly eradicated, but typhus is turning up in growing numbers along the Texas border and in some big cities like Dallas, Fort Worth, Houston, and Austin. Health officials in Texas are saying that cases of typhus are climbing faster than expected, and many patients are actually winding up in the hospital. In the 1990s, there were only about 200 cases documented in the entire state of Texas. But from 2010 to 2019, over the past decade, the number of cases has gone up 12 times that. So, John, let's start off with the most important question. What the heck is typhus and how does it spread?
Right, and this is, another one where we could really talk about this is a zoonotic disease. This is a bacteria, a rickettsial bacteria, and there's different species of this type of bacteria that causes a clinical syndrome, right, that generally presents as flu-like illness, and one of the challenges with it is when people get sick, they can look generically like so many different things, right? Fever, muscle aches and pains, generally not feeling well. But if it isn't treated early, it can sometimes turn into some very serious, even fatal symptoms. You know, neurologic disease, different organs get impacted. You'd be better to talk about that. But this is a bacterial disease carried by rodents and other peri-urban wildlife and cats. And so we can get into why we're seeing this increase. But I think, let's talk about the symptomology too, Jay, because that's important. Are doctors recognizing this more easily now? Is it usually on your radar as a physician?
Honestly, almost never, right? Like it's the type of condition in which you're almost certainly going to end up only getting diagnosed with it if you end up in the hospital and you're severely ill. So after you get exposed, so just so we understand, the majority of these cases, we believe, are people who are coming into contact with like the feces of fleas, right? Like
Please.
the
That's
like
right.
the poop, like flea poop.
Yep.
And particularly if you have cuts on your skin, you're homeless, you don't have access to hygiene, that flea poop gets into those cuts, and a few days after you get that exposure, you can get a fever, you can get a headache, you can get body aches, and you may get a rash. But the problem is, most doctors, if you see somebody like that, you're just going to assume the patient has an infection with a virus and it'll just get better on its own, when in fact this is an infection that does respond to antibiotics, particularly most first line antibiotic like doxycycline,
Mhm.
and patients end up doing fine. But I think what's happening almost certainly is that a lot of these people are probably being diagnosed really late, and they're only getting diagnosed because they get really severely ill because they
Go
haven't
to the
gotten
hospital.
antibiotics.
Yeah.
Yeah.
So this is not unlike the transmission cycle of plague. We talked about that earlier, where you have something that's carried by rodents. The fleas bite the rodents, and you're right. It's the feces of the fleas. When we get exposed to that, we get infected. And so, why do we see increases in this? And if it's the homeless population, we have urban areas that attract wildlife like rats and other rodents that can be carriers. And of course, the higher density of these rodents you have around people, the more likely it is that people, and homeless people would be particularly vulnerable because they're probably exposed to rodents more frequently, that they are going to get fleas on them and get exposed to the feces. And so that's, I think, part of what's happening, and not only in Texas, but we've been seeing increases in California. That's the second state that has the second largest number of cases in the country. And so there's a lot of discussion of, why is this making a resurgence? Why are we starting to see more and more typhus, Jay?
Well, that's a really good question. And I think, let me talk about the human factors, and then I want you to talk a little bit
Yeah.
about the animal environmental factors. I mean, the human factors almost certainly are related to the first topic we discussed there, which is homelessness. When people are unhoused and don't have reliable housing, they're first of all, they're out in the environment, so more likely to be exposed to animals or other environmental contaminants or environmental hazards like flea poop. And then second of all, they're less likely to be able to clean off, that once they get exposed. And third, they almost certainly don't have regular access to healthcare, or if they get access to healthcare, it's by showing up in an emergency department only after they are extremely ill. So we have a big housing crisis in the United States, particularly in urban areas, but it's also in rural areas. And I think that is one of the big human factors that's increasing risk. So, John, what about the environmental risks and the animal risks that are putting people at risk?
Okay, well, there's two things that could be contributing to this increase. And let's mention that there are two types of bacteria that can cause the disease we're calling typhus. Rickettsia typhi, which is one type of bacteria, or murine typhus, carried by mice and rats and other rodents, and Rickettsia felis, which is carried by cats. And both can cause this illness in people. So one thing we're seeing of it with climate change is an increased abundance in fleas. They're doing better in warmer climates. And with a higher flea density, they're biting more hosts, more rodents or cats, as it were. And there's more ability for you to come in contact with a flea because there's more of them. Now, in terms of cats, feral cats are an issue as well. In places where there's a big feral cat population, they're particularly susceptible to these fleas. And it begs the discussion that when you have pet cats and those cats go outdoors, flea control becomes so important. Making sure you're giving them regular flea preventative can help reduce the likelihood that you would be in contact with any fleas that might get on your cats. But with feral cats, they don't get flea control. So more cats, more rodents around people, and warmer climate, so more fleas, makes for a recipe of more transmission of these rickettsial bacteria.
All right, John, I got to ask you though. I thought the more cats we have, the fewer rodents we have. That's
Maybe.
the whole reason to have a cat, is to keep the rodents away.
Sure. And maybe to a point, but I'm just not sure they can keep up. It's true.
Yeah.
There's way too many feral cats out there, but I'm not sure they're that effective at rodent control. If you've ever walked the streets of New York City, you'd know that rodents just are pretty successful around human settlements.
Yeah.
And so, because both rodents and cats are susceptible to getting bitten by fleas, and each of their fleas carry a version of this rickettsial bacteria that can cause typhus in people, it's like even more chance that we're going to get it if we're outdoors a lot and around some of these peri-urban wild animals, including feral cats.
Yeah. And this explains why this is, even though we started saying, well, this is typhus in Texas, it's not just Texas. Like, let's look at California. Los Angeles, for example, had an increase in cases from 31 in 2010 to 171 in 2022. So typhus has essentially become endemic in parts of Southern California, Los Angeles County, Orange County, and it's particularly in that homeless population. So without question, they're coming into contact with flea poop. And it may very well be due to the increasing number of rodents, increasing number of feral cats, and then, of course, the increasing number of humans who don't have a home to be. Hey,
Yeah,
John,
and Jay,
go ahead.
Oh, no, I was going to say, I have a great typhus story. I got to bring it up
Okay.
right now
All
because
right.
when am
Everybody
I
needs
ever
a
going to get
typhus
this chance
story.
again?
Okay. Everybody needs a typhus story. Go ahead.
But it was while I was spending time at the CDC as a vet student, and I was there on rotation for about 6 weeks. I was in the what at the time was called the rabies and rickettsial division,
Yep.
right? And as a student, if you're interested in emerging diseases like I was, and so many of these happen internationally, you're dying to go get sent out on an outbreak response. Okay, so I was there
Yep.
and I was doing work, in the rabies branch, but going, oh God, let there be something where they need an extra set of hands and send me to Asia, send me to Africa. I'm ready. And one day the call came and I couldn't believe it. They said, Epstein, we got an outbreak response. You want to go? And I said, oh my God, that's amazing. Where is it? They said, downtown Atlanta. What? Yeah, like 10 miles from CDC headquarters. I said,
Yep.
no, God, where's the international? But it was a case of somebody who had died from typhus. And in fact, it's not this standard kind of typhus we're talking about, but something called sylvatic typhus or endemic typhus, which is carried by wildlife, carried by specifically flying squirrels. And the story was this was somebody who worked at a lumber yard. And one day he developed fever. Then he lost he went to the hospital, lost consciousness, went into a coma, and ultimately died. I think of renal failure, if I'm remembering. And it turned out after the investigation that the lumberyard was infested with flying squirrels, and one of them had died in the air ducts of the office building. So the carcass was plastered against the filter of the air thing, probably had fleas or flea feces that were desiccated and aerosolized. And this guy ended up breathing it in and getting sick from that. So it was a really interesting story of just local transmission of typhus, which you don't see very often.
So the moral of the story is don't let flying squirrels get into your ducts. Oh my goodness.
Don't spend time in lumberyard
I
offices.
know. This is the beauty of CDC investigations, right? You find some absolutely amazing things when I've been on outbreak investigations. So I'm sorry you didn't get to go to an exotic location, but that is an amazing example of,
Yeah.
yeah.
It was a terrific experience. It was an incredible zoonotic disease. So as a young veterinarian, it was really exciting. And, I more than made up for it later in my career with the international stuff. But it was really, a new disease I hadn't really known about, gave me a chance to learn about it. And
Yep.
this rickettsial organism is Prowazeki is, again, it's much rarer than typhus or typhi or felis, but it is also out there. Possums can carry it, flying squirrels in this case. Actually, possums can be a carrier for typhi. And then this Prowazeki is pretty much in flying squirrels only. So really interesting stuff. And in our own backyard.
Yeah. Okay. So John, what are we going to do about it?
What are we going to do about it? Okay, so let's start with our pet cats.
Let's give you a job. You
Okay,
are, the commissioner of health for the state of Texas. And let's assume for the moment you also have control over veterinary health
sure.
issues and environmental health issues in that role as well. Or Southern California, LA, Orange County. What would you be recommending that people do?
Well, look, as you've identified, if homelessness is really one of the major risk factors for this uptick in cases, then we need to do more to control rodent populations in urban centers. That's always been, every city's challenge, but here's yet another reason, a public health reason to maintain lower rodent populations that should reduce transmission and address homelessness, provide more shelters, get people off the streets so they're less likely to be exposed. And so that's probably first and foremost. From the standpoint of exposure to cat fleas, of course, as I mentioned, I think all cats should be indoor cats. And that's because I know how devastating cats can be to wild birds and other wildlife. But if your cats go outside, make sure they have flea preventative on board and don't let that lapse. So that can protect them and you from fleas. But, in the case of these outbreaks, I'd say rodent control and helping homeless people get off the streets.
All right, John, those are great messages. I think we want fewer rats outdoors and we want more humans to have a home indoors. And I think that's a lesson we could that's a message I would hope that there is no sort of political dispute about. And with that, thank you very much for joining me today. For everybody out there who is watching or listening, please, as always, hit the like button, hit subscribe, put something in the comments, get engaged, because, we are dominated by an algorithm. And so the more that you can show us some love or show us some interest, the more other people can learn about public health. They can learn about interesting issues like this, and we can help protect public health for everybody else out there.
Yeah, it's a good message. So, take care, everybody. Be well. And Until next time, Jay. And I want to hear a good story. You were in New York City. You must have worked with the rodent czars that we have trying to control those populations. So next time, you got to talk to me a little bit about rodent control in New York City.
I will. I also have a CDC medical student outbreak story as well. I got to go to the exotic city of Pittsburgh. So I'll tell you about that in a future episode. All right. Thanks a lot, everybody. Bye-bye.
Bye-bye.